Mark Cantrell, Fire Chief.
And I'm Michael Miller, the Chief of Police. The city of Colleyville takes the coronavirus very seriously. And as first responders, we've been planning for several weeks to ensure that all of our first responders are able to be protected when they're out there, and that we are able to continue the services that the community depends on, fire and police and EMS.
We put a kit together that allows them to safely respond to these emergencies. The kit includes some things to help not only protect the first responder, but protect the patient as well. So a couple of masks available, one for the patient and one for the first responder. Eye protection, a Tyvek suit, various size gloves, and hand sanitizer for use after the call. As cases increase, you may from time to time see us responding in equipment such as this. This is equipment that is available to us currently that we issue. We don't use it as much, but you may see a situation where you see us responding in something like this. There's no need to panic. It's just something that we're going to do as a normal part of our process. In addition to that, we also have decontamination policies in place that will allow us to decontaminate after these types of calls.
The CDC has actually released guidelines for both fire, EMS, and police personnel. And so we shared that with all of our employees. We developed a response guideline for before a call, during a call, and after a call. Police and fire and EMS, we have to be able to respond 24 hours a day, 7 days a week. And so even when our personnel are put in situations where they may be exposed to the coronavirus, we have put measures in place to ensure that they will continue to be able to respond.
So in addition to our internal policies, we also have mutual aid agreements. We have partners around us that we share a dispatch center with. Our dispatch center has a plan in place, a protocol in place for asking questions related to this. We also have shared resources with all of our neighboring agencies. So in the event where we were to be overwhelmed, or they were, we would be able to share and partner with each other to mitigate the situation.
This is all part of a regional response to the coronavirus. And so we're all working together to ensure a consistent response, to ensure that we've got adequate resources to deal with any problem across the region. This is essentially Emergency Management 101. These are situations that we plan for. We've planned for in the past. We have plans and protocols in place for these things to ensure that we continue operation 24/7.
I think the single most important thing is for you to understand that we're trained, equipped, and prepared, and that we're here for you 24 hours a day, 7 days a week. There's some really simple common sense things that we can all do on a daily basis. You know, you want to wash your hands for at least 20 seconds. If you're coughing or sneezing, make sure that you're not doing that on someone or toward them. If you're sick, stay home. Use hand sanitizer with at least 60% alcohol in it. One of the really important things you do is avoid touching your mouth and your eyes, and just take a little time to clean your working surfaces with some Clorox wipes or some sort of disinfectant. If you need any additional information, there are some really trusted resources out there. CDC, Tarrant County Health, State Department of Health. You can also find that information on our city website.